Welcome to the lecture on histochemical stains. So let's see what are the stains are used for what the organisms. The acid-fast bacilli is used for mycobacterium organisms like Mycobacterium tuberculosis. How will the tuberculosis look? The tuberculosis will look like a bright red rod but against a blue background. The acid-fast bacilli stain is also used for Cryptosporidium parvum. We should not confuse this with Cryptococcus, which I will be telling in the subsequent slides. Desmin. The desmin stain identifies the muscle cells specifically. What about GMSA and HNE stain? The GMSA is the gold standard for parasites. So how can you remember it? GMSA, I have this clue like IPL, which are the matches which take place in India, right? So instead of I, you convert it as T. So TPL, T stands for Trypanosoma pallidum, P stands for Plasmodium, and L stands for Leishmania. What about the hematoxylin and eosin hematoxylin staining? So before we go into eosin hematoxylin, how will the nucleus be? The nuclei is basophilic. What is basophilic? Is basophilic blue or pink? Basophilic is blue. How do you remember that basophilic is blue? B for B. So basophilic means blue and that is the nuclei. The cytoplasm is pink and that is eosinophilic. So this is how the eosin hematoxylin stain works. Let's see about the other stains. What about Cryptococcus? So this is what I told you, not to confuse with the Cryptosporidium parvum, which stains by acid-fast bacilli, acid-fast staining. So Cryptococcus detection is by India ink, where as you see here, there will be black background with white haloed yeasts. So this is how the India ink will be, and it is a negative ink, where we will be seeing the Cryptococcus. How about muciramine? It is a red capsule staining. What are the lipid stains? The lipid stains are, we need to think the red oil red O and Sudan black both will stain the fat. So when we have to diagnose fat embolism or for steatoria evaluation, then the lipid stains like oil red O and Sudan black can be used. So how do we remember it? We can think of a clue like black oil, or the Sudan black stains the lipid droplets as black. So you can associate black with oil. Therefore, the Sudan black for lipid stains can be remembered. What about the PAS and the Prussian blue stains? The Prussian blue stain is useful for iron detection. Fine. So this is essential for any places where we need to detect iron, like in sideroblastic anemia, where iron deposits are present in the mitochondria. Whereas in PAS stain, it is used for to see the macrophages in Whipple's disease. Why? The PAS, periodic acid Schiff stain, positive, and periodic acid Schiff stain negative is there. The periodic acid Schiff positive macrophages are those macrophages which will be containing glycogen. So they will be present in the lamina propria in Whipple's disease. Periodic acid Schiff PAS negative is mucin. So that is not into consideration over here. So we need to know that Whipple's disease shows PAS positive macrophages in lamina propria. With this, we will see about the silver stain applications. What happens in silver stain? Silver stain is helpful to visualize the difficult to stain organisms. The key ones are the H. pylori, the spirochetes, as well as the Pneumocystis jerovaceae and Leishmania species. So, how do we remember this? First, we can remember at silver spirals. That is, the H. pylori is a spiral shaped bacteria. The spirochetes such as Treponema pallidum and Borrelia are also spiral shaped. So silver spirals will help us to remember the spirochetes as well as the H. pylori. Then the other mnemonic is silver shadow. So why do we call it a silver shadow? The Pneumocystis cerevisiae will appear like crushed ping pong balls or like foamy exudates in the alveoli. So they are delicate and they are faint. So silver stain gives them the definition, like bringing out the ghosts with silver. So you can remember it as silver shadows. How do you remember the third leishmania? Silver sand. So just imagine how there will be if there is a beach with silver sand. So you can remember it like that. Why do we associate silver with the sand? The leishmania is transmitted by sand fly. So the sand leishmania is stained with silver stain. In this way, we can remember the organisms, pathogens which are stained by silver. Just a recap: the Helicobacter pylori, spirochetes such as Borrelia and Treponema pallidum, leishmania, as well as Pneumocystis cerevisiae are all stained by silver stains. With this, we come to the end of the histochemical stains. I am Dr. Veena Velmurugan with a passion for teaching. If you like my videos and if you'd like to get mentored by me, you can send me a message in the comments and we can take it forward. Have a good day.